When referred to a neurologist for a potential seizure disorder, the physician will examine you and obtain your medical history. If the physician feels that diagnostic testing is warranted, ambulatory EEG test may be ordered. This is an accurate way to diagnose both epileptic and non-epileptic seizure disorders. Diagnostic EEG testing can be done on an ambulatory or at-home basis. This enables your physician to capture 24 to 72 hours of clinical data without a hospital admission, thus resulting in greater convenience and less cost. You will be greeted by one of our EEG technologists who has been trained, licensed, and credentialed to perform this type of test.
Measure your head with this tape measure.
During the setup, our caring and highly skilled technologist will educate you on the process and answer your questions about this safe and painless procedure. First, the head is measured and marked to ensure proper electrode placement. 16 to 24 electrodes will be placed on your head using a conductive paste and special glue to hold the electrodes in place. But don't worry, the paste and glue will be cleaned from your head at the end of the test. Your electrodes, which are simply small metal discs with thin wires, will be connected to a miniaturized head-mounted amplifier, which collects electrical signals produced by the brain. The electrodes are designed to pick up tiny electrical changes, which are produced by the activity of the nerve cells in the brain. Once your electrodes have been attached, your head is wrapped with gauze to hold the electrodes, wires, and amplifier in position. Depending on the orders of your physician, your test may be video recorded. In those cases, you will be provided with a video recorder that is easy to set up and use at home. Video images coupled with the electrical signals from the brain can be very valuable to your doctor when certain types of epilepsy syndromes are suspected. Following your setup, our technologist will provide you with instructions for your test and set up an appointment for you to be disconnected. The technologist will review key points to ensure you have a successful study. Check battery power periodically. Change the batteries when battery power is at 75% of power. Make sure you can be seen in the display on the video unit. Stay plugged into the video unit with a coiled cord as much as possible. Complete the activity and event logs and bring them to your disconnect appointment. Based on your clinical history, your physician may order a study lasting just 24 hours or as long as a few days. Following your test and disconnect, your brainwave activity is downloaded onto a computer file for your physician, who will interpret the brain patterns and be able to determine the treatment that is best for you. When you return for your disconnect appointment, the head wrap electrodes will be removed and the technologist will prepare the data for your physician to review. During your follow-up visit to your physician, he will discuss the results of your test, provide your diagnosis, and talk with you about your treatment options. Medications are often prescribed to treat seizure disorders.